union stewards. We're talking about some of the needs that we have, some of the safety precautions that we want to take, and we want to make sure and ensure that our health and our safety are a priority in our district. And so based on your feedback and the information that you all were trying to gather last week, we were able to get somebody that is an expert in this field. And so I hope that you have some paper, that you have, something handy to write with, because you should be able to gather a lot of really important information. So I hope that you're taking really good notes. So if you see on your screen, you will see Miss Amy. Let me tell you a little bit about Miss Amy. You got to know who she is. Miss Amy Baru has been a safety and health specialist and educator for 30 years. She's an associate director in health and safety at the American Federation of Teachers, where she has trained hundreds of members and developed curricula on bullying, workplace violence, emergency preparedness, and indoor environmental quality. She is also a part-time lecturer at the Rutgers University School of Management and Labor Relations. She holds a master's degree from Hunter College, City University of New York in environmental and occupational health science, and is an industrial hygienist. So I want to not take too much time, just let you know that you're going to learn a lot, and we hope that you gather a lot of information, because what is going to be presented to you is going to be key and crucial as we start to think about how our schools are going to reopen. So I'm going to turn it over to you, Amy.
Thank you so much, Carla. This is really a privilege to be here and to share this time with all of you. I appreciate you all being here. You all worked a full day, and you're going to be working another hour and a half, learning some new things. So I'm going to share my screen and go over some slides. So let's start there. All right, play from start. So hopefully everybody can see this at this point. This is our mission statement. And I just want to say what I hope to get out of this session by the time we're done here is for you to get a good understanding of some of the key health and safety considerations for a return to brick and mortar buildings before you walk into in-person instruction. Hopefully we will be able to teach you how to do a walk around inspection of not only your classroom, but the entire school building as best as possible. And you're going to learn how to complete the building survey checklist that we put together for you. And it even is able to attach photos to the document. So I'm really excited about that. Before I get started, just so I have a little bit of background, I'm going to launch a poll because I want to know who's in the room. So the poll is just what your job classification is and what type of school that you work in. So I have launched, and poll away. Got a lot of elementary instructional staff so far. Couple more seconds here. All right, elementary school still winning. And so is instructional staff. Okay, I think everybody that wanted to vote has voted. So I want to share the results just so everybody knows who's in the room. Like I said, 97% instructional staff and 36% elementary. So that's good for me to know as we move on. So first thing I want to say is that we have a lot of information, but we're still learning a lot of information every single day about this virus. It's a novel virus, which means we don't have a lot of information, period, end of story. And we're learning as we're going. We do know that these are the three routes of entry, we call them, or three main ways this virus spreads. It's primarily from droplets, from sneezes and coughing, from sick individuals, but we've also learned that aerosols, or very small particles, are a source of transmission. So that is an important key piece. We're going to talk about that in a little bit. A secondary route of transmission is by touching objects, any kind of surface objects, and then it has to be like a perfect storm. You get virus on your hands, and then you touch your eyes, your nose, or your mouth, and that's a route of transmission. It's not a primary route. It's really a respiratory disease. So if we had breakout rooms, I'd have you do this. But what I want you to think about is assessing your own personal risk of exposure. So we know right now that your risk of exposure to this virus increases if you have less than 6 feet distance from people. In school settings, we're mostly concerned about special education settings because sometimes you need to be closer than that 6-foot barrier. We're worried about high occupancy classrooms and spaces and not enough air being brought in to dilute the air in that space. Crowded corridors and halls. I think we've all seen the pictures from Georgia with kids passing in the halls, and it's just utter pandemonium. Ventilation, which we're going to spend some time on, and coach support of student athletics is an issue, and anybody that teaches band or choir classes, because that spews out a lot of virus potentially. So it decreases, your risk decreases when you put these things in place. Wearing a mask, it's easy to do. Everybody should be wearing them in school. Teaching in low occupancy classrooms. So we want to keep the density down in the spaces in which we're working. We want to keep distance throughout the day, not only in classrooms, which is probably the easiest place to maintain distance, but in all other spaces in the building. We want to enhance and improve ventilation if we can, and rapidly get people who are experiencing symptoms out of the space and dealt with through the proper channels. So, just think about this in the context of what your expectations are when you walk back into the buildings. Okay, so this is what we know now. Back in the end of July, AFT added some information out from our original document that was put out in April around what we think are the key things for reopening school buildings safely. And I'm going to put safely in bunny ears here because we really don't know what that means yet, because this is a novel virus. We're basically learning as we're going. And as scary as that sounds, we just don't have all the answers yet. So all we can do is put in the best practices we know now and evaluate how well that works. Okay, so this report that we put out, it was mainly focused in on, making sure community transmission in the areas under control, that there's a public health component, that the public health is intimately involved with the school district in contact tracing and all disease surveillance and things like that. Making sure that those who are at higher risk have accommodations if needed, and that the union is part of the planning process and the other key stakeholders, right? Parents, things like that. So those are the bigger picture, but the ones that I focus in on are the health and safety pieces. So this presentation is just going to be on health and safety considerations. There are a lot of other things that may be a factor, but for this presentation and for what I do, health and safety concerns are what I'm going to focus in on. So these are the 5 main areas that we want to focus in on for a return to brick and mortar buildings. And, it's kind of a repetition of what we talked about for risk assessment, right? So it's having a 6-foot physical distance in your workspace from other people, improving ventilation and other building systems like water systems, having resources and the staffing needed to actually clean and sanitize facilities, the mandatory wearing of face masks, and actually, as crazy as it sounds, access to hand washing facilities and building in time for people to wash their hands, as crazy as that sounds. So there's never going to be a one size fits all for this process. There's going to be different ways this is addressed in each school. That's part of the problem. Every building is unique and every situation is unique, and every constituency, it's going to be different, and it might be harder in elementary schools to get kids to wear masks and things like that. And you might, on the flip side, in high school have resistance there as well. So, it's going to be a process that we just have to develop over time. I will say that the things that I'm going to talk about are all parts of a puzzle, and you can't finish the puzzle without every piece. So each one of these components need to work as a system. And at the center of that, I couldn't figure out how to do a puzzle piece with it in the center, but it was at the center of this is the union really having a say in how a safe return looks like, what a safe return looks like, and has a say in that process. So I'm going to talk a little bit about what we're going to be asking you guys to do, which is a walkthrough of your building. I want you to know that this is the start of a process. This is going to be a continually evolving process, but it's an important starting point. That we're going to use the information that you gather through these walkthroughs as evidence to show whether or not we feel that that school is ready to be reopened, if it meets our metrics of all these health and safety concerns. Taking pictures is going to be an important way to document what you see throughout this entire process. So keep those phones handy. The other thing that you might want to think about having in your pocket is a tape measure, because we're going to want to make sure that we have distancing protocols in place. So the tool that you're going to see, this is an older picture. It's not going to have my email address on it, my Gmail address on it, but it's going to be a digital Google Doc survey form that you can walk around and type on your phone or on your laptop or your tablet. I want to warn you, there are a lot of pages to this survey. Do not freak out. They are little tiny pages with maybe 3 questions on it, but the way we put it together, the way Nat put it together actually, is to separate out each type of situation so that you're not inundated with a page of a whole bunch of questions. So it's actually easier. It just looks like it's longer. So don't freak out. And the other thing I'm going to say is that there will be questions that you will not be able to answer, and that's okay. And that's really the point of this exercise, because if you don't know the answer, we need those answers before we can say it's safe to go back in that school, or it's okay that they've met the requirements in that school. So how we did this, develop this checklist for this walk around is we looked at your LOU that the union negotiated with the district and used that as a basis for the things you should be looking for in the school. And I know I'm talking to a bunch of shop stewards, building reps. I don't know what you're called down there. We call them chapter leaders and building reps and shop stewards. It depends on the local. But I know I'm working with union activists that are not shy. I should have mentioned that I have a very loud dog. Oh, sorry. I'm so sorry. So you're not shy. So if you don't have an answer, find someone that might. Don't be afraid to ask the principal. Don't be afraid to talk to the custodial maintenance staff, because they might be your allies in this. The school nurse, so find people that might be able to help you find some of these answers if you can't find them. But in the end of the day, if you can't find them, that's okay too. So right out from the get-go, some of the key things that we want to know for each school is who's the point of contact, who is the person ultimately responsible for responding to any concerns in your particular school. Is it the principal? Is it the school nurse? Is it somebody else that we don't know? But it's important to know who the point of contact is. The other thing I think is really important is what's the communication process for your particular school? have you gotten clear information from your administrator or your principal about what the protocols are, what to expect, when to attend the training that they're going to require? Okay, all those kinds of things. The other thing that I think is really important, and I have not seen it in your plan because I've looked at it, is a process for reporting any problems or anything you think is a violation of any of the protocols that are in place. We need to find that out because it's going to happen, right? We're going to see things and things are going to happen in the school that we're going to need to report to, and we want some sort of transparency so that if we report a problem to, you know, the point of contact who's responsible, we want to make sure that we get an answer to those inquiries. Okay. One of the other questions that I have, and I don't know what's going on in Miami as far as this, but other districts are doing these things called cohorts. They're called pods in some school districts. I use a lot of bunny ears, sorry. And that's where you keep students kind of together, especially in the younger grades, and then other support staff and other teachers like the specials come in to that classroom, but that pod stays together. I don't know if that's happening. It's something to look into because that's another way to minimize the possibility of, you know, if someone's infected, spreading it farther than the pod that you're in your given class. One of the other things that you want to look at in the building overall is have they determined if other spaces are going to be used as classroom spaces or instructional use? So are they going to take the auditorium and redesign that so we can have classes in there, the cafeteria, the gym, things like that. So those are just things in the general category that's right at the front of the survey to start thinking about. And the other thing I want to say, I'm from New Jersey. I talk fast. If you need me to slow down, I think you can, in the participant list, raise your hand or something like that. So just let me know if I'm going too fast. So the first one I want to talk about and spend a little bit of time on is physical distancing, because it's a key component in this whole process. And really, we need to plan for physical distancing in all spaces. Like, we kind of know what to do in classrooms, sort of, right? We know we need to spread people out, but what do we do when people are lining up to get on and off the bus? What do we do? How is it being done during mealtime? You know, are kids staying in the classroom and eating, or are they going to the cafeteria? How are they getting there? You know, what about when they are in hallways and stairwells? You know, how are we going to assure that physical distancing measures are being considered in these spaces? There's a lot of challenges with the physical distancing. It is a challenge because every school is going to be a unique situation, and that there has not been a lot of tools developed for administrators to actually put these things in place. And the biggest problem I've seen in pretty much every school district I've talked to is that they keep passing the buck. It starts at the CDC. Oh, this is what you need to do. And then it goes to the governors to put in a plan. And then the governors say, well, this is what you should do. And then it goes to the school districts. And then the school districts say, okay, principals, you're responsible. And ultimately, in a lot of school districts, our school staff are the ones doing the work of actually figuring this stuff out. So that's a challenge, and not a lot of guidance in figuring this out. Luckily, Education Week had a series of articles about how to do social distancing that's practical and easy to comprehend, right? And you're going to be getting a fact sheet on this that has pieces of the script here and the next picture I'm going to show you. But when you're looking at your classroom space or the space in which you are working, if it's not a classroom, you need to measure the room width by depth, which is pretty straightforward. But then you have to subtract any stuff that's in that room that's eating up your space. So if you have cabinets, if you have you know, bookcases, if you have cubby holes, if you have, you know, all these, the desks themselves, you have to minus out that space, those calculations from that space to really get a true handle of what the square footage should be. So Education Week uses a metric of 44 square feet per person. And that's a little bit more than the 6-foot distance because people aren't static. They don't sit in their desk like this, right? We all know kids. They're going to be up, they're going to be doing this, they're going to be going here. And every time you get up from, if you're just in a static 6-foot distance, you're invading someone else's space. So they expanded the available space from like 29 square feet, which is a true 6-foot distance, to 44 to accommodate not only the desk, but the walking area around that desk. Okay. So kind of like the picture I had at the beginning that they were marking out the tape. And then, you know, that way you'll know how many actual students can fit in a classroom. So this is the graphic you're going to get on that fact sheet when you get it. But this takes a typical classroom. For in this case, it's a 960 square foot room. So 30 by 32 with the furniture in it. And when you do this and you remove the furniture and you put people in with this 44 square feet, it takes a classroom that's normally a normal capacity of 31 down to a capacity of 12. All right, so that's a huge difference. And this is going to be one of the biggest challenges you face because there might not be enough classrooms to, you know, socially distance at this level. There might not be enough instructional staff to teach at this level, right? So this is going to be one of your biggest challenges, and figuring out who's actually responsible for distancing, figuring out these metrics in your classroom is an important thing to know. All right, so everything I show you from here on in blue, the stuff on the left-hand side, is your LOU, okay? So what we did was we took the information that was in your LOU related to physical distancing, social distancing, and put it in this blue box, but we also correlated that with the walkthrough notes. So when you get when we look at the survey, you're going to have a box, you know, to check off. Is your classroom set up with 6 feet distances? Okay. If it's not, if you look in the second bullet, if these guidelines cannot be implemented, they have to put in alternative options. That might be a reduction in the number of students or an alternative classroom setting. Okay, so this is what's in your LOU. Okay, so this is what is primarily what you need to focus in on, because you want to make sure we have these things in place. All right, the second part is on the removal of furniture, excess furniture, and if there's proper signage. So these two things in blue, again, in your LOU. So we want to know, have they removed the furniture? If you don't need it in your room, it should be out, right? Because you need that space. Have they put signage or any kind of barriers, even if it's just tape on the floor to mark things out to help maintain that 6 feet separation? Okay, and really you want to look at not only your classroom, but other occupancies in other parts of the school, right? And that covers staff, students, and even visitors that come in through the building, okay? This is also from Education Week, and they talked about designating directional flow for hallways and stairwells. Okay, so this is just an example on how markers should be in the school to do directional flow in a building. Okay, your LOU talks about this in the second bullet where it says, if the layout allows, schools will use one-way hallways and stairways to avoid crowds in hallways. Okay, so this is what they've said, if it allows. So we have to figure out Is that happening? And if not, why is it not happening? What are the barriers for that actually being able to be put in place? Your LOU also talks about limiting the number of people in either restrooms or elevators, okay, to 2 at a time. So my question is always, well, who's going to be the restroom, elevator, and hallway police, right? Who's doing that work to make sure that that's actually happening? So the questions I have on the walkthrough notes, and you're going to get copies of this, so don't freak out. You're going to get a copy of this. So I know I'm throwing a lot of information at everybody, but you know, these are the kinds of questions that you're going to see in the survey that we need to find answers for, right? What controls are in place to prevent the congestion in restrooms and elevators? You know, they can't just say that they're going to be limited. There has to be a plan in place to make sure that that's actually happening. Okay, same thing with lining up in the morning even to come in. Are they going to have separate entrances by grade? Are they going to have separate entrances, you know, by area in the building? You know, all these kinds of things have to be considered before the first day you go back to brick and mortar buildings. All right, so those are some of the considerations. I'm going to just touch briefly. I know we don't represent any bus personnel in Miami, but riding on the bus, there's 2 ways you can do it. If you don't wear masks, it's going to be a very limited bus. If you wear masks, you can have a couple more, but normally, you know, you're going to reduce the capacity to almost half in any situation. And the reason I'm showing this is that we have in the LOU that these things have to be in place. So on the buses, they have to be wearing face coverings. They have to be 1 kid per row. They have to have hand sanitizing stations on the entrance of the bus. They have to have signage, and the bus has to be cleaned. Because ultimately, these kids are getting off the bus and coming to you, right? So we want to make sure that these things are in place so that, you know, you have some protection on the flip side. Okay. Everybody still with me? All right. So I want to talk a little bit about ventilation. This is probably the more technical piece of it, but I'm going to say right off the bat, you don't need to be an industrial hygienist to do anything on this checklist. We are going to get you through this, and it will make sense. All right. And I learned things from Michael today that I didn't know about Miami. So first thing, the reason ventilation and filtration is so important is that any space, indoor space, needs to be diluted by bringing in air from the outside. Okay, and so it's a system where you bring in outside air, it recirculates in with some mixed air, and then is exhausted through the system. So the ventilation is important, and the filtration is important. And we're going to talk a little bit about filtration. So there are certain filters that you can use in systems that are mechanical to help remove some of that virus if it's in the air as it's going through the system. Okay, so we're really trying to design this so that air doesn't blow from one person into another person's face or space. Our position at AFT is, and I'll share a fun story if you're not paying attention to all the fun CDC stuff that's happening. Our position is that it's transmitted, SARS-CoV-2 is transmitted both by large droplets. And so the large droplets relate to the 6-foot distance, right? So large droplets, when you sneeze, cough, sing, talk loud like me, any droplets that come out of your mouth that are big generally will fall between 3 to 6 feet, which is why the 6 feet marker is so important. The problem is that not all of those droplets are large and fall to the ground. There's a lot of smaller particles called aerosols that are much smaller and hang out in the air around you, and they can travel further distances, and they can stay suspended in air for a longer period of time. So the way I like to visualize this for people is that everybody has seen, you know, spent an afternoon cleaning their house and they think it's all clean and dust free, and then a sunbeam comes in the window and you see all the dust hanging out there and you're like, dust. And then the sun goes away and there's no more sunbeam that's showing those dust particles. It doesn't mean they're not there. The sunbeam has just shown you that there's things flying around that you can't see. That's the same thing that we're talking about with aerosolization. So we believe that enhanced ventilation can help remove both the large droplets that are the ones most people hear about, and also the smaller particles that are aerosolized. Okay, so what I learned today is that you have 3 different kinds of filtration systems in your buildings. You have windows with window units and an exhaust only system. You have ceiling AC units, and you have HVAC systems. And we can work with each of these to enhance some ventilation, but it's important that you know what kind of systems in your building, because that's the only way we can help you address some of those concerns. And you probably, in most of your buildings, have multiple types of systems. So you might have in the cafeteria or the auditorium, you might have a mechanical HVAC, heating, ventilation, and air conditioning unit, but in your individual classroom, you have a ceiling AC unit. So just, so I can see what you know here. Let me see how I do poll 2. Let me know what kind of a ventilation system you think you have either in your school or your classroom. This is so fun. Okay, is everybody done? If they want any last takers on the poll? Okay, I love your honesty, people. Okay, most of you have no idea. And that is a fair statement. And I am not surprised. But right behind that is a lot of people that have HVAC systems or multiple systems. So, but for the most part, this is all going to be new information from you, and you're going to learn stuff about health and safety and ventilation and MERV filters that you never really wanted to learn. But you're gonna, if we can. So that's a good handle for me, because I'm going to explain these systems a little bit just so you're comfortable with it. So if you have just windows, okay, like just say you have windows and that's the only thing you have in your school, which is kind of common in where I'm from. But in Florida, I think you need air conditioning in almost every space. But the way that would work, and it's similar to the air conditioning system that you'll have suspended from the ceiling in your case, is that for the windows, you have air that comes in through the windows or the spaces in between the windows that brings it in, and it is pulled out and up through the ceiling and to the roof to a central exhaust fan. And so it's like a circuit. So the air comes in, and then it does the good stuff it's supposed to do in your classroom, and then it's sucked out through the door, either vents in the door or above the door, and comes up through the ceiling and exhausted through the ceiling fan. I'm pretty sure, although I'm going to double check because I do not work frequently with air conditioners suspended from the ceiling, I think that may be the same type of situation where you have an AC unit in either your windows or your ceiling, but it's still exhausting through a central exhaust fan in the ceiling. But I am gonna follow through and do a little bit of more digging around how those systems actually work. So when you have situations like that where you have, especially windows, it's a really hard thing to control for because, you know, the way that it's usually done if you have windows is you have to have windows either on both sides so that you have cross ventilation like in your house, or you have to have the door open and a window open to create the flow. And the door opening issue is a security issue. So we're running into problems where people can't keep their doors open and that is leading to problems with ventilation. So there's a lot of problems. Security, it's not filtered, it's noisy. You know, in Florida, it's always hot. So, you know, those issues are a problem. For HVAC system, you know, I'm not going to go into great detail here, but when you have a central system, you have at the top of the system, so up here on the roof most of the time, you have vents that are drawing in outdoor air. I used to call it fresh air, but I don't really call it fresh air anymore. I call it outside air because, you know, it depends on where you are, how fresh it is, right? So you have outside air, outdoor air that comes in. What's happening here is that it's mixing with return air. So you're breathing in this room, you have a whole bunch of people, you have an exhaust vent that's drawing air up, and it's going up here into this, what's called a mixing chamber, okay? So air that's coming in here will then get remixed with the recirculated air and then be pumped back into your classroom. So when you're sitting in your classroom, you're never getting 100% outside air. You're getting, depending on how the system's set up, 15 to 20% of outside air to 80 to 85% recirculated air. So this is why ventilation is so important with HVAC, is because we need to make sure that the filters that are on this system that's cleaning that air are at the best that we can get for that system, and that this outdoor air is being brought in at a higher rate than normal. And I'll tell you what that looks like. So, you know, I hope I'm not losing people here, because ventilation is scary to a lot of people. But there is recommendations that the CDC has recommended from ASHRAE, which is the American Society of Heating, Refrigeration, and Air Conditioning Engineers. So these are the people that put and design all the ventilation systems, the big systems. And so they have a lot of recommendations that now CDC has added to their guidance for K through 12 schools. And it is really designed to increase the delivery of outside clean air from outside to dilute anything that's inside that space. So that's what I'm talking about. We're talking about increasing the outdoor intake, maintaining. These systems are incredibly complicated. You have systems that have, you know, all these louvers and belts and filtration systems and, you know, cooling coils. It's a very complex system, and somebody has to spend a good chunk of their day making sure that they work properly and making sure they're all calibrated right. So that's why ventilation is really, you know, it keeps me up at night sometimes. And then one of the things they recommend is filtration, and I'm going to talk about that in this slide. So MERV 13, it is the level that will, it is the filtration level on the filters that will remove the virus, the small particles, that aerosols that go through a system. So MERV 13 or better. So they have, I think it's MERV 13 up to maybe MERV 19, something like that, up that scale. And I know Miami's looking into MERV filtration, I believe. We just want to make sure that in places where we have HVAC systems, these guys are in place. And the other recommendation is that these systems are tested to make sure that they're working right. And one of the other recommendations that we have is, if there's a possibility of getting the district to get, they may sell them both portable and the ones that can go on the wall, CO2 air quality monitors. So CO2 is what you exhale when you breathe, okay? So in a given space, we use that as an indicator gas. It's not harmful in and of itself unless it's way crazy numbers. But if you start to see an increase in the CO2 levels, it means that either the space is too crowded or there's not enough fresh air or outside air that's coming in to dilute what's going on. So the trigger for us is 1,000 parts per million. When you start to see numbers on a CO2, this is different than carbon monoxide, that will kill you. CO2 is carbon dioxide. When you start to see levels at about 1,000 and higher, it means that there's not enough of that circuit that's completing, that's going to bring in fresh air or more outside air into that space to dilute the CO2. I hope that makes sense. I see that, you know, just as a FYI, I see questions in the Q&A and in the chat. I'm going to try to get to as many as I can when I get through this. And if I can't, we're going to collect all of those questions and get back to you directly with answers. Okay. Just wanted to, I think we were supposed to say that at the beginning. So your LOU doesn't have any specific agreement on ventilation. So I just put in here the things that I think are important for you to look at. So, and this is the questions, most of you will not be able to get the answers unless you're friendly with the custodial maintenance guy or person who is responsible for these systems. Perhaps if you can get information from the school principal or the facilities person, that would be great. But these are the kinds of questions that we really want answers to before we have people go back in buildings, okay? Including ventilation enhancement versus offices and ventilation rooms, okay? All right, moving on. Number 3. We are at cleaning and disinfecting. So this is the one that a lot of people fixate on is cleaning, 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 and it's probably the least concern as far as transmission of this virus. Doesn't mean you don't clean and disinfect. It just means you don't have to go full tilt boogie with bleach and all this other stuff. Actually, the coronavirus is a very fragile virus. If you use soap and water, it breaks the outside shell of the virus and kills it. So just soap and water will kill the virus. But even with that, you need to have a system in place. You can't just go straight for the disinfecting, right? You can't go straight for the spray guns and all that kind of stuff. You first have to clean the surface, and that is, you know, microfiber cloths and a cleaning detergent, okay? It can be soap and water. It doesn't matter what it is. You have to clean surfaces first before you can disinfect them, because if you just disinfect them, it's just a coating on top of the dirt, and it really doesn't get to the removal of the germs, okay? So very important that there's 3 levels. You have to clean first. If you choose to sanitize, it gets most of it, but most people are going straight for the disinfectant, and that is where you're going to kill all the germs. And I'm sure you're using EPA-approved products, so I can follow up with that, and that's going to work on getting me your safety data sheets on your chemicals, so I can follow up with you on that as well. So you have a lot of information in there around cleaning in your LOU. Basically that workspaces are supposed to be regularly sanitized. I have no idea what that means. You need to find out what that means. Does that mean they're going to do it in the morning before students come, in between classes, when they're, you know, between the use of shared surfaces, before and after meals, you know, or is it just going to be at the end of the day? So that's a question. They have it in here. I think you need more information. Like, you need to know what the disinfection and cleaning protocol actually is and who's going to be doing that work. Okay. So in the LOU, it also talks about paraprofessionals doing some of this work. That's fine, but people need to be educated on how to protect themselves if they're using products that they've never used before. And once we find out information, I'm happy to help with that information too. You're not covered by OSHA in Florida, unfortunately, but public workers in other states have what's called hazard communication They're covered by the hazard communication standard, which would require training on the chemicals that you're going to be using, how to use them properly, how to protect yourselves, and what personal protective equipment they should be using. And, you know, quite frankly, and Carla, I'm jumping on your toes here, but if the school district's not going to do that for you, I'm more than happy to help you guys if that's something that you're going to be responsible for doing. Anyway, that's a big thing for me, that there has to be, you know, one of the concerns we have, because people are chemical crazy with these disinfectants, is that certain chemicals like bleach and things like Lysol that have terpenes in them are asthma triggers for people, for adults and for children. And we want to make sure that that kind of stuff isn't happening with the cleaning protocols that are in place. So I'm just throwing that out there. All right, our next area of which we're going to focus is face coverings. At least I'm very happy that you're requiring face masks for everybody in Miami. That is not the case in other school districts across the country. I want you to know that face coverings are not considered PPE. They are face coverings, but they should be required in all indoor spaces in schools. Okay, you're going to need, one of the things that's not on the checklist, but for you to put in your head, the ability to have mask breaks, and what that means and what that looks like and where that happens. But wearing a mask for 6 or 8 hours at a shot is not fun. And it's, you know, it's, they get hot, they get annoying, people start touching their face, and that defeats the whole purpose. So what I want you to know, and I think people know this by now, that it's very limited protection. It's mostly for other people being protected from you than you being protected from other people. And it's mostly designed to protect you from any large droplets or any splashes within that 6 feet. The problem with face coverings is that when you wear like a respirator, you have a really tight fit, which prevents any of those smaller aerosols to get in from behind that mask. But if you wear a face covering, there's lots of holes in that. It's not a tight fit. So it's limited protection. They don't protect your eyes from exposure. And like I said, when, you know, I see it all the time, you know, people are wearing face masks and they're touching their face, they take it off, they stick it in their pocket. It's going to be an issue because kids really don't know how to use these well either. So it will be an issue. Additionally, what really is PPE, or the things that are on this in the red boxes here, and there are people that are in school that should have real PPE, personal protective equipment. So that might be, you know, having N95s, which are, you know, what you see in for healthcare workers. It might mean goggles for some people to protect anything from splashing or getting into eyes, because that's a big route of entry for this virus. It could be a face shield, which is something that you wear from here on the forehead down below your chin. Not, you know, that would be in addition to a face covering, you know, and gloves, you know. So think about who in your school might need extra protection. For me, besides the obvious of the nurse, is anybody who works with special needs children who need to get close to those children. We have paraprofessionals and special ed aides that are responsible for, you know, diaper changes. They're responsible for feeding. They're responsible for lots of different activities that bring them very close to that student. And it's our position that those folks should have personal protective equipment equivalent to what a nurse would have for those exposures. People that are doing occupational therapy, people that are doing speech pathology, right? You're going to need additional types of protection if you're going to be within that 6-foot space. So just think about who in your school, if that might be you, think about what other protections we might want to be asking for those kinds of folks that can't maintain that 6-foot space. For some special needs children, it might be scary for them to see people in a mask. They might not understand. They might be grabbing for it. So we just have to think these things through before we just throw people into a space to figure it out on their own. Okay. We do have some information from the LOU that I'm very happy that they're requiring everybody to wear a face covering. The one thing, and I can't wait to see it, is what the mandatory professional development is regarding the safety protocols. I hope it's not one of the videos they have on their website only. And that the schools are maintaining a supply of facial coverings for employees to make sure that they have consistency in the wearing of them. So that's a good question to ask. I'm assuming, but tell me if I'm wrong, that students will be required to bring and wear their own masks. And that's a whole, another set of complications with that. And I'm hoping that the school also has a supply of face coverings for smaller people if they forget to bring their mask or, quite frankly, don't have one from their home. So questions is, the employer really should, the district really should be doing an assessment to determine who needs additional PPE and that they have enough of it in their stock for the foreseeable future. Okay. Other things that are in your LOU are the physical barriers. So these are all going to be in the security stations and the front offices in your schools. This is good stuff. The only thing that I'm concerned about here is that we want to make sure it doesn't block any or inhibit any of the airflow in the building. So we just have to make sure of that, and that they have to go high enough. Like in this picture, you can see in this picture how high this goes, but I've seen them where they're closer to here and people have to duck down if someone comes in, and that's kind of defeats the whole point, right? So we just want to make sure that they're the proper size and that they're installed in these spaces. All right, we're almost to the end, folks. So hand hygiene, okay? I think people are probably sick of washing their hands. It's so important. It is the most crucial piece here for spread, for people touching things, all right? So we need to have a good protocol in place for hand hygiene. You have great concepts in your LOU, right? So soap and hand sanitizer has to be readily available in all bathrooms and common areas. We want to make sure that's actually happening. I can't tell you how many schools I've been in where you walk in, not only do you not have soap or paper towels, but you don't even have warm water, right? So we have to make sure that they hold their end of the bargain up and that stuff is all available. You guys agreed to hand sanitizing stations in high traffic areas and on the school buses. Excellent. What I will say about hand sanitizer is it's a temporary gap. It's a temporary measure until you can get to a proper facility to wash your hands. Okay. So if you are, getting on the bus, getting off the bus, when you get to school, you should wash your hands, right? So it is only a temporary solution, and that we really need to get into a handle, into a routine of routinely washing our hands, even when we don't think that they're dirty, right? So one of the things that I'm really concerned about is, are there going to be schedules in place or breaks in the day where students can go wash their hands? It's going to be really hard when you can only have 2 people in a bathroom, right? So we have to figure out how our kids and even adults going to have access to go wash their hands. It's a big issue. The other one is safe access to safe drinking water. Some of the things we want to document is if there's any electronic or no-touch fixtures and soap dispensers. If there are hand dryers in the bathrooms, we want to have them disabled, because what happens with those air dryers is it blows air up into your face, and whatever germs are in the room, hello, you're going to be breathing those in. So we generally say that the air dryers should be disabled and paper towels should be supplied in bathrooms. And that they have enough supplies in place to actually keep up with demand. Okay. This is in your LOU. It's not in your checklist, but I just want to reinforce that you have a great LOU in place, that staff will have to do daily screenings upon coming in. You'll get a little badge that you can say that you got to school and you completed your screening. And that, you know, if you report and, you know, one of the things isn't, you know, you've checked off, you have some sort of symptom, you're going to get compensated for the day. So just something to keep in mind. I know for me personally, it's allergy season, and you can probably tell by my swollen eyes and my very raw nose. I look like Santa, you know, I have a very red nose. Allergies are kicking my butt. And so, you know, we have to make sure that, you know, those kinds of things are not going to kick people out from coming into the building for routine things that are just like not COVID related. Some of the things also in the LOU are around getting students who are exhibiting symptoms to an isolation room. So an isolation room is someplace where students should go that are completely separate from any other place. So if you have a nurse's office, you're also going to need a separate room for an isolation room, because if I'm a kid and I'm coming in for a Band-Aid, I don't want to walk into the nurse's office and be in the same room with students who are in quote unquote an isolation room right next to me, right? So we want to make sure that that is a separate space. When it says it's monitored by an appropriate staff or school administrator, that's great. You guys were able to negotiate that it's not any of you that are doing that work, which is good. But we want to make sure we know who's ultimately responsible and what happens if that person or the school nurse is out. You know, what's the backup plan? Okay. One of the big things with the nurse's room and the isolation room is having enhanced ventilation. This is where you really want to make sure you have good ventilation. And you might even need to bring in things like portable HEPA units. You know, they're about $300 at this point, but it's an investment that should probably be considered in isolation rooms, because that's going to clean the air in that room only, so that it doesn't get out into the rest of the ventilation system. Okay, and may have enough space in those spaces to provide that physical distancing. All right, so let me just, okay, there's so many questions, I don't know how to do this. So I think what I'm going to do right now is show you the actual instrument, and then I'm not sure anybody can talk in this, but maybe we'll go to the chat and see if you have any particular questions. And then we'll come back and just finish up this. So I stopped that. Give me 1 second. And I want to go here. Okay. So this is where you're going to find the actual survey. So this is going to be your new, I don't know, health and safety little graphic, because what I will say again is that you can't have just one in place. You really need the complete puzzle to be fixed or put together for this all to work. This is your fact sheet that was just uploaded. That's going to be for you to give out to your teachers and staff in the buildings. That talks about examples of the distancing. So that's good. Nat, if you can talk to me, or Michael, if when I click on this, does it switch automatically to the next page?
Yeah, we can see it.
Okay, so this is the instrument. So like I said, there's a lot of questions here, and I'm going to fill this out as if it's me doing it, just so I can get through pages. And I'm, you know, becoming an employee, so I'm going to put that in there. I'm going to put, I'm at school, and I'm going to do a 4-digit code, right? So this is just general information. The next section is the general questions I talked about earlier. So who's the point of contact? Who knows? Have you been provided with clear in communication? I'm going to say no, just for fun. Will students be in cohorts? I'm going to say we're not sure because I have no idea. And I'm going to say they're going to look at the gym for using instructional. Okay. So this is what I'm saying. They're short little pages. Like this one only has three pieces on it. So you see me moving through this, right, guys? Nat? Okay, I'm going to assume that you can still see this.
Hi, Amy.
All right, Nat, can you see me when I'm switching
What'd you say?
pages?
I'm sorry, I missed that.
Can you see me when I'm switching pages?
Hi, Amy.
Nat,
Yes.
can you see when I'm switching pages on the web page?
Yep.
Okay.
Yeah, we're on physical social distancing page. I see that.
Okay,
Yep.
that's all I needed to know. Okay, thank
Okay.
you. Sorry about that.
No problem.
Okay, so has the school established maximum occupancies? We're not sure. Well, we might add not sure here, because that's what I would probably say. Who at your school will, you know, control traffic? I'm going to say, you know, the principal. All right. Have they provided guidance to workers on how to protect themselves? Probably not, I'm going to say. All right. So this is on your classroom. So we have in here, and this is classroom, or if you're in another space, if you're a security or somebody else, whatever your space is, just write what your space is. So I'm going to say I'm in room 1, 2, 3. And then this is going to be about my personal space. Okay. And we're going to go through these questions. You know, do you have social distancing in place? Sure. Has non-essential furniture been removed? Sure. Do they take into consideration movement through the building? I'm going to say maybe, because maybe you don't know yet. And are there any physical guides on, like tape on the floors to do that? I'm going to say no. That's something you should consider doing, by the way. So I have in here another section, like you can go, if you want to go to the library, if you want to go to another person's classroom, if you want to go to the front office, it's just the same questions that you can answer for a separate space. Okay. The next one is around hallway movement and student circulation. So this is all the questions that we were talking about. Are there controls to prevent congestion in the elevators? Have they determined what patterns they're going to be in the hallways? Are they marking barriers and to prevent bottlenecks? And is there a plan for when classes are changing? Okay. Next is the main office. So when we go in the main office, have they installed that plexiglass there? Is it large enough to provide the 6 feet between multiple people? Does it have any enhanced ventilation? Probably you're going to check not sure on that, right? This is the early dismissal protocol. What are they doing when students are coming into school and leaving school? What's the protocol for visitors, deliveries, any kind of contractors that are coming in? Okay. This is figuring out what kind of ventilation you have. And we'll probably add in here air conditioning, ceiling air conditioning, because that's a good chunk of you. This is about windows. If you have operable windows, if there's any fans that work or any kind of enhancements in the windowed spaces. This is all the questions for the HVAC, the mechanical systems, you know. Are they working with HVAC professionals? Have the filters been upgraded? Are the dampers allowed, open to allow maximum fresh air? You know, all these questions. This is probably your hardest page, page 11, and where you're going to need to make the most friends in figuring out these questions, okay? Cleaning and disinfecting. This is all based on your protocol, your LOU. And we want your assessment based on what you're seeing. Do you think that they're cleaned good before you actually open up the building? And when are they cleaning? And if you can get the cleaning protocol, grab it, because we want to see that. We want to see what their protocol is for cleaning. Here is around PPE, personal protective equipment. Again, all stuff that I just covered. Have they done a hazard assessment to see who needs additional protection? Do they have enough inventory? Are these the kinds of supplies that they have in place? Have they, if anything's not in yet, because we're hearing this a lot too, well, we're getting stuff. We've ordered it. You know, well, we ordered N95s at AFT back in March. We just got them. It's October. It's going to be October. You know, it took a long time. We got the first shipment, you know, so it takes a long time to get material that everybody and their uncle wants, right? So not only do they have to worry about getting it in, but they have to keep it stocked so that people can have access as we go through the school year. This is the hand hygiene that we talked about, you know, making sure people have access to soap and running water, paper towels, that all the sinks are working in the bathrooms, a schedule to have students wash their hands, all the other things I talk about, the hand dryers, having access to enough hand sanitizer and other supplies. This is the nurse's office. If you can get in there or talk to the nurse, she's your ally or he's your ally as well. You know, whatever you find out here ultimately impacts you as well, because kids are going to be coming and going to the nurse's office and then coming back into your spaces. This is again, with the nurse's office, this is the isolation checklist. So making sure that there is a separate room for kids that are having symptoms or adults that are having symptoms, quite frankly. And if they have additional things like additional ventilation or enough room and social distancing and the like. Who's in charge of those spaces? Having an area where people can put on and take off and throw out PPE after they see someone who has symptoms. So there's a lot of pieces with the nurses, and I know you guys don't represent them, but ultimately it impacts what goes on here, impacts you directly and indirectly. This is a big one. Is there a plan in place when the nurse is out sick? Okay. Last and not least is, well, two things. You can attach things. I don't see how to do that here. Nat's going to fix this all up. We're going to figure it out. But we want your photos. We want anything that you have. If you're taking a video, we'll take it. If you have any supporting documentation, you get a copy of the cleaning protocol. We want it. You know, if you have any kind of photos that you think would be good to tell your story, we want to see those, okay? And that's, how you use that is outside my world, but I know we have people that are ready to take this information that you gather and move on it. And last is the open-ended. And I will tell you that in the surveys that we've done so far around reopening conditions and considerations, this is where I get the most valuable information, because you're going to tell me what you're most concerned about. The pictures are great. The checklist is great, but I want to hear your narrative about what you're walking into in these buildings. Okay, so please, please, please consider telling us your story of what you're seeing. It's been really powerful using this information. We've done this, we've done similar things like this in Boston, in Providence, Rhode Island, and it has been really good to convince people that it might not be such a good idea to run back to brick and mortar buildings when we're not ready to do that. And these are the reasons why, and this is what the situation is. So that is the survey instrument. And I'm just going to, Carla's on. I'm just going to come back to, if I can find this again, where did I put my presentation? Where was I? Two things, Carla, before you jump in. I just want, and I'm going to send this to Nat and to Michael and to Carla to hand, to get out to you guys. This is really, really stressful times for everyone. And I want people to take care of themselves and understand warning signs that, that you're experiencing stress and potentially trauma, right? So everybody in the country is experiencing heightened anxiety, right? And so we have a couple fact sheets about taking care of yourself, and that we want to make sure you have something every day to focus on that's positive, and to just be very alert to changes in your own behavior and thinking and emotions. And know that you've got this. You have resiliency, and so resiliency is something you can learn and you can develop, and we want to help you do that. So this is a fact sheet. I'm going to make sure that Carla and Michael and Nat have this, and we have another one with other resources, just so, I just threw a ton of information at you and maybe scared some of you, and I don't want to do that, okay? And then, just to wrap it up, the survey data is going to be incredibly important to Carla and everybody, because it's going to be used to build a campaign to keep people protected, right? We want to make sure communication is key, that we want to have a point person in the schools, and we want to have written protocols in our hands, the health and safety concerns we talked about. And the last thing I just want to point out is that everything I'm talking about, everything that we're asking you to look at, is all an experiment. These are living documents. We have to change as we learn more information, and where we see things that are not working, we have to adjust. So just because there's a plan and there's a very pretty PowerPoint from Miami, the school district, it really doesn't have a lot of meat. And we have to make sure that we can change these plans as we learn more information. So with that, lots of talking at you. I'm really sorry. I don't know if anybody wants to direct questions to me, because I haven't really been paying attention, but I see there's 63 comments in the chat. So I don't know what you want me to do from here.
Yeah, so Amy, first I want to start off by thanking you. Thank you very much for your expertise. I mean, obviously, you are an expert in this, and we really appreciate the valuable information that you shared with us. I think that a lot of the questions that are in the chat are very particular to the LOU, which obviously you came to give us a general, overview of what are the things that we should be looking for in our school sites, in particular to our classroom settings or our work settings, so that we are in safe places when we're back at work. So for everybody that is still on, and we have had great turnout, we want you to know We're going to put this video up. We're going to share this information. We will put it up on the steward section. I think that the question that we get most of that I'm seeing is the physical distancing in the classrooms. And that's going to be the tricky part, right? Some people don't know who's supposed to be measuring. Hey, I would be measuring my own space. I wouldn't wait for somebody else to measure it for me. So what I would say is make sure that that you see that slide is also on our webpage. Our LOU asks for the 6 feet, where 6 feet is not available. It allows for the World Health Organization. But if you are overcrowded, if your class roster is too big, then you need to reach us. You need to contact us so that two things could happen. Either they can decrease your class roster, or they can relocate you to a space that is much bigger so that you can do adequate distancing. Health and safety are going to be key and extremely important. And if there's anything that you've learned from this presentation, is what those things are that you need to be doing. And there's multiple things, right? It's not just one thing that you do. It's multiple things that are part of the puzzle on keeping everybody safe. And so if you need a larger class, then you need to make that known to your administrator so that they give you a larger class. If you need a smaller roster, because obviously that number of students is not going to fit in your classroom, then you need to let them know that you have spaced out your classroom and that according to the space that you have, you can only fit X number of students. If you have more than X number of students in your class, then now is the time before school starts, before in-person school starts, now is the time for your administrators to start leveling that off. So again, we're gonna have this presentation available for all of our stewards to see. We wanna make sure that they have access to this because there are some people that were not able to get on. And if you have any of the participants that are on here right now, if you have any questions, please reach out to your organizers so that they can help you troubleshoot any issues that you're having at your work sites. But we want to make sure that we're doing our due diligence on our end as a union that is protecting workers' rights. In this situation, we see that the community also is supporting us. They are concerned over children's conditions, learning environment. And so we're going to keep on talking about what our agenda is, and our agenda is safety above all. So Amy, again, thank you so much for giving us so much information. Your knowledge has been truly invaluable. I mean, you have really taught us a lot. I appreciate everything that you put together, how you compared our LOU and the things that were in it, and how that impacts different work environments in our school sites. So again, thank you very much. On the chat, you'll see that the links are already there, or where you can find the checklist so that you can do it on your iPad, on your computer, on your phone. If you have a smartphone, you have that checklist where you can walk around the school, look for those things and check that off. And of course, you also have a link there as well in case you want to report anything that you're seeing at your work site that does not fit any of these standards. Remember, we have a campaign in South Florida right now. It's #SafeSchoolsSFL. So if there are any things that are not part of the safety parameters that we have embedded in our LOU, if you see that they're cutting corners, that they're not doing things properly at your work site, we want you to take pictures, we want you to report them, because at the end of the day, we want to make sure that when we reopen, when we are in person, face to face, that we have everything that we need to secure and have a safer reopening. It's not going to be the safest because we're under COVID, but it is safer, and that we are taking all these safety precautions and making sure that they're in place. Again, Amy, thank you very, very much for everything that you've done and that you've presented. And I will let you close it off and say good night to everybody.
I just muted myself. I really appreciate this time. I know I threw a lot of information at you at a very short time period. Carla, I just want you to know I'm here for you, and whatever you need moving forward, including a redo of this. If we have more people who want information, I'm happy to do that.